everyone, my name is Mia Harris. I did my evidence-based practice proposal on electroconvulsive therapy, also known as ECT. ECT was developed in the late 1930s and it has been used to treat mental illnesses, particularly major depressive disorder. ECT is often used to treat chronic depressions in patients who are no longer responding to antipsychotic medications or psychotherapy. The purpose of this evidence-based practice proposal is to evaluate the effectiveness of ECT compared to other treatment options for individuals who have treatment-resistant depression, to also assess the efficacy of ECT in reducing symptoms and achieving remission while considering existing research and clinical outcomes. There are extensive research studies and reviews that support the effectiveness of ECT in treating chronic depression. It is estimated that the effectiveness of ECT in treating depression is about 80 to 90%, and remission can be achieved in 40 to 50% of patients. ECT was evaluated and approved by the National Institute of Health and Care in the UK in 2003. It was also approved by the Food and Drug Administration in 2018 to be a very safe and effective treatment for chronic depression. The next two slides are just some studies that were conducted using ECT to treat chronic depression in some patients. Of course, the result of these studies they show that ECT was associated with overall improvement in the depressive symptoms for the participant and also improvement in their mental illness. The side effects reported by most of these patients who are treated with ECT is mild cognitive decline after the procedure. So here is another study that was conducted, regarding ECT treatment, and this other study revealed that ECT has a greater antidepressant effect than some antipsychotic medications such as the MAOI, which are the monoamine oxidase inhibitors, tricyclic antidepressants, and selective serotonin reuptake inhibitors, the SSRIs. Despite the substantial evidence that support the safety and effectiveness of ECT practice, there are still some controversies and stigmatizations about how the procedure is performed and also about the side effects of memory loss and cognitive decline that follow after ECT treatment. ECT is performed under general anesthesia, usually propofol and muscle relaxants. The treatment is administered with the instrument called the Megaspectrum 5000 device, where electrodes are placed on the patient's head to introduce electric currents in the brain to produce a generalized cerebral seizure. The seizure that is produced causes cellular and chemical changes in the brain. ECT affects major neurotransmitters in the brain such as dopamine, serotonin, acetylcholine, endogenous opioids, and epinephrine. These are the hormones that control moods, appetites, and sleep. So ECT is said to relieve depressions by controlling these neurotransmitters. ECT treatment is used across the United States to treat chronic depression in patients who have been treated with antidepressant unsuccessfully. It is considered a last resort, but it's still very much in use today. Here is a recent study that was conducted at a medical center in the U.S., which I'm going to just say is Snow Medical Center just to protect the privacy. The study was conducted with 40 adult patients, ages 45 to 65, who were diagnosed with major depression and were not responding to antipsychotic medications or antidepressant. The inclusion criteria for this study, the patient had to have a diagnosis of major depression according to the DSM-4. The patients will have to have been on a long-standing prescription of antipsychotic medications with no effect. The patients had to be 45 years or older, and the participant had to be willing and able to give informed consent. Now, the age here, just 45 years or older, was just done for this study, but ECT can be administered to people 18 years of age and above. So the same study that I was talking about in the previous slides is a continuation of the same study. The exclusion criteria for that study, the patients who are not willing to take part in the study were not forced. They were excluded from the study. Patients who were unable to give informed consent, they could not participate in the study. Patients that have brain tumor, patients with intellectual disability, patients who were substance abuser and have abused substance in the last 6 months couldn't participate. Patients with active neurological or medical conditions that would affect the treatment response or cognition were not allowed to participate as well. These are some of the tools or materials that were used in the previous study to assess depression, to assess the effectiveness of CT after the procedure. The Hamilton Depression Rating Scale is a 21-item scale that is used to measure the severity of depression. The scores range from 0 to 7, which is normal, and 8 to 16 will indicate mild depression. 17 to 23 will indicate moderate depression, and anything over 23 was considered severe depression. The quick inventory of depressive symptoms, QIDS, is a scale that is also used to assess the severity of depression. It is a 16-item scale where the score ranges from 0 to 27, with the highest score indicating worsening depression. So if, as you can see here, a score from 0 to 5 is normal, that means no depression or less. 6 to 10 is mild depression, 11 to 15 is moderate depression, 16 to 20 will be severe depression, and anything above that will be very severe. There is a newer skill that is used to assess cognition. This is the electroconvulsive cognitive assessment. This is a 30-item questionnaire that is used to assess cognitions in patients who are undergoing ECT. The score range from 0 to 30, with higher score indicating better cognition. So these are the results of the study that was mentioned in the previous slides. The 40 participants that underwent ECT, they show reduction in their depressive symptoms with a mean score of 16.5 before the ECT was performed, and then and 7.8 after the ECT, according to the Hamilton Depression Rating Scale. The participant also reported reduction in their depression symptoms according to the QIDS. They had a mean score of 20.4 before the ECT treatment, and then 11.5 after the treatment. There was cognitive decline noted in the patient as expected, which is a side effect of ECT treatment. The patients, they had a mean score of 28.5, which is a higher cognition, and before the ECT and after the ECT treatment, they had a 24.5, which is lower, which is decreased cognition. They also reported some memory loss as well following the ECT project, according to the ECCA. So the primary side effects of ECT treatment is memory loss and cognitive decline, which have been reported by many patients who have undergone ECT treatment. Despite this problem, research and clinical evidence have shown that ECT is a safe and effective treatment for chronic depression. Majority of patients who have been treated with ECT have reported great reviews about the procedure. Some say that they would rather have ECT treatment than suffer with chronic depression. There is not a lot of research evidence to support any kind of change to the ECT treatment or procedure. But the change that can be proposed in the use of ECT treatment is to implement interventions and treatment plans that will counteract the side effects of the cognitive decline and memory loss. Patients who are being treated with ECT can be prescribed medications that can prevent memory loss and improve cognitions. There are medications such as ceticoline, ginkgo biloba, and huperzine A have been known to enhance memory and improve cognitive health. This next slide is a testimonial of an actual patient who was treated with ECT. So basically, she was very satisfied with the procedure, and she said that it worked very well. She said she will recommend this procedure to anyone who is suffering from chronic depression, and she said that it changed her life for the better, and her family was elated, and she was able to have a normal life. You can just go ahead and read the testimonial on your own, just to understand what she was saying. This is the end of my proposal about ECT treatment. Thank you for listening. The next two slides are just the reference pages, pretty much just the reference pages. All right, thank you. Take care. Bye.